So we're going to start the discussion with Maureen Barlow. As someone working with the public every day, I'd imagine that you have some unique perspectives in terms of how people perceive their risk, what they wear in terms of protection, and the degree of worry that most Canadians feel when it comes to COVID. I'm wondering if you could just start by talking about your experiences that way. Tell me a little bit about how you think people perceive the risks of COVID-19.
Yeah, sure. So I've been a part-time retail employee, essential worker since basically for about 4 months since the emergency was declared, state of emergency. And I've seen quite the gamut of behavior. And it's interesting because we started off just business as usual and kind of hoping for the best. And then eventually, as the risk was elevated, we started to put into place more protective measures, everything from the physical distancing, the hand sanitizer, asking customers to use that. It's quite cute, actually. They hold their hands out and ask for it. And but there is a percentage of the population who don't want to do it for whatever reason. Some have health issues. Some just, I don't know if they think it's a conspiracy or something, they don't want to do it, but we can't force them. So, we have to just allow that. Mm-hmm. I guess what we want people to realize is that, they might be in and out of the business quickly and they might have washed their hands, but we don't know that 100%. And we're spending all day inside a room, if you will, where hundreds of people are coming in and out. And we just want to do our best to minimize what's brought into that environment, not only for our sake, but for the sake of the other shoppers.
So I guess, that brings us to our first set of questions, which is about personal protective equipment. So I'm going to put it out to Dr. Hill and Dr. Mahajaran. Both of you have worked in community health and epidemiology. Do we wear masks or not? What's the bottom line?
The thing is that the data and the scenarios have evolved over the last 12 weeks. And what we know today is different than what we knew at the very beginning of this. And so with all of the variables that are involved in any given situation, the research and the evidence continues to evolve, and the risk becomes very difficult for any individual to predict. What we do know is that things that are common and uniform amongst infection prevention still reign true. And what I mean by that is that keeping your distance, so that 6-foot distance between people, hand washing or hand sanitizing, not touching your face, and wearing a mask are all things that will decrease the risk of you contracting and transmitting the infection. And so the OMA best evidence is that you wear a mask if you're leaving your house and you're not certain that you will be able to physically distance. And so if you're indoors in someone else's house, you should be wearing a mask. If you're indoors in a mall, you should be wearing a mask. If you're out at a beach and you're not sure about being 6 feet away from everyone else, you should be wearing a mask. And as Maureen said, I wear a mask to protect you, you wear a mask to protect me.
Excellent. Dr. Mahajaran.
Just to add to what Dr. Hill was just saying, I think that one of the things that we really have to understand is that we need to know a little bit about this virus, and also we need to understand how we get it. And Dr. Hill mentioned that, and how we pass it on. So just about in terms of something about the virus, it's not a living thing outside of a human body, outside of a host. It has all of the material that it needs to reproduce inside a human body, and it's very good at doing that. Once it gets to a human body, but it needs to have some assistance. It needs to be helped into the human body, and it cannot just actually fly into a human body or go through the skin or anything like that. So I think we need to understand something about the virus. We cannot fear it, because I think the fear will paralyze us. The fear will actually not enable us to find that balance between taking protection, and doing things, that we need to do in life. So I think we have to respect the virus. but not really fear it. So some understanding about the virus is key. In terms of masks now, I think like Maureen was saying, we need to wear a mask when we go outside the house, particularly when we don't know that we can maintain the 2 meter or 6 feet social distance. There's many more ways to get the virus than actually to transmit it, to pass it on. So for example, you can touch a surface and touch your face inadvertently and get it, that way.
Do we know how long the virus lives on surfaces?
So, that's the other thing about, I think, getting to know the virus. As soon as the virus comes out of the host, of a human body, it starts to deteriorate. I think, the evidence, again, is evolving. I think I have seen descriptions that it could be hours. Mostly it is hours rather than weeks. And maybe a few days, but it also conditions really matter. So heat, sun, these things matter in terms of hastening, speeding up the deterioration or the deactivation of the virus. So, but we don't know how long it has lived, how long it has been on a surface. So we had to assume the worst. And that's why the hand hygiene and not touching your face and wearing a mask is so critical.
We received a lot of questions about other protective equipment, such as gloves and face shields. Can we talk briefly about the effectiveness of those? Should we be wearing gloves when we're indoors at a store or visiting family? Does that help? And are face shields more effective than masks? I'm putting it out to anybody. Feel free to jump in.
All right, I'll jump in. So again, I'm going to start with, and I'll probably start the answer to every question this way because it's one of those things that I think that you have to keep repeating until people hear it properly. The most important things you can do are physically distance, wash your hands, and wear a mask if you're in public. That being said, we're talking about gloves and face shields. Gloves are tricky. As someone who operates for a living and has seen many medical students come through the standards of learning, it takes a lot of time to realize that when you have your gloves on, all it does is protect your hands. So if you're wearing gloves and you reach over and grab something and then put that thing in your basket and then take your gloves off and reach that thing from your basket, the gloves have served no purpose there. So I'd say for most people, the gloves are not going to be helpful. I would leave the gloves for the medical professionals and just use really rigorous hand hygiene. Wash your hands when you can, sanitize periodically in between. Face shields are really important as far as procedures that are what we call AGMPs, which are aerosol generating medical procedures. So when you're intubating someone or when you're up close and someone's face is coughing. For the regular person, for the average Joe walking around, it's not clear how much face shields add. Again, that's today's data. 2 weeks from now, we may be telling a different story as we learn more. But what we do know for certain is physical distancing, hand washing, and masks in public.
There's been a lot of concern about the safety of hand sanitizers and how often should you use hand sanitizers and how much is too much. Health Canada just recently recalled a whole bunch of different hand sanitizers from different manufacturers because of a high ethanol content. But I'm wondering, like on a most basic level, hand sanitize, is it better to use soap than hand sanitizers? And then the second part of that question is, when you're using soap, can it just be a basic bath soap, or is it better to have an antibacterial soap?
There's absolutely no reason to ever use an antibacterial soap unless you're doing something like scrubbing for surgery, at which point we use a whole different realm of products. Any bar of soap will work, any hand pump of soap will work. Basically what happens is that the soap and water combine and they create little bubbles that incorporate the virus into them. I'm trying to be non-scientific in my language, so excuse me if this sounds a little bit funny, but basically it incorporates the virus into them. And so when you wash your hands, you wash the virus or other dirt down the drain. Soap and water is always the best option over hand sanitizer. Hand sanitizer is a great alternative when you don't have access to soap and water. But if you do have the option to go wash your hands with soap and water, that's always the best option.
I think regular soap, getting a good lather on, and actually, washing your hands for 20 seconds or more, until you can get through your happy birthday, maybe twice, and I think, so I think we, hopefully this whole pandemic would have helped us rediscover basic hygiene.
There's one more question about wearing masks while you're driving. And so we've had quite a number of readers actually say that they see people in their cars all by themselves wearing masks. And wondering if anyone can clarify that. Is that necessary? What would be the reason behind that? And is that one place that we should reconsider wearing masks?
I don't think it is necessary. Unless actually you have a passenger that you are carrying in the car, particularly that who is not somebody that you're living with.
I'd really love to see us get back to a place where we are judging each other a little bit less and trying to approach a little bit more with curiosity. Honestly, what someone else is doing in their car probably isn't relevant to you unless you're wondering what you should be doing in your car. And so the truth of the matter is a car is a contained environment. If it's going to be switching people driving it, it might make a lot of good sense. If you're dropping someone off or if you're going to pick someone up, it might make a lot of sense. If it's a shared car between people who don't share a household, it might make a lot of sense. But the other thing is that I know physicians who wear their mask home because when they leave the hospital, they don't have access to anything to clean their hands with. And so you're never supposed to take off your mask until you clean your hands. You never bring your hands up to your face until they've been cleaned. And so they walk out of the hospital, they walk over to their car, they open the door, they get in, they drive home, they walk in their front door, they sanitize their hands, and then they take off their mask.
Right.
It's not because there's something in the car they're worried about. It's because it's a basic principle of not taking off your mask until you've cleaned your hands. And I could see that might apply to someone who's gone grocery shopping as well or anything else. And so I think there's probably a lot of good reasons for people to be wearing their masks. And even if the only reason is just that it makes them feel more comfortable, it's certainly not doing any harm.